Hi, Mr. Eugene. I am Ms. Ramirez. I am the PA who's going to be taking care of you today. I understand that you're here because of a wound that you have in the back of your hand that you got while you were cutting some boxes for your science project. First of all, can I verify your name and date of birth? Okay, perfect. Now I'm going to be giving you some information about the procedure that I'm gonna do, but I also, uh, are you allergic to any medications? Okay, and when was your last tetanus? Perfect. Okay, so I recommend for this type of wound to do something called a continuous suture, and I recommend this because if you don't get it, you can't. Some of the indications for this is that you have that wound in the back of the hand, which has some loose skin. Um, Also, this could if you don't get it, this could give you an infection or even cause scarring. In addition to that, other options that we have is that you have staples or some type of glue, but it's not very recommended for the type of wound that you have right now. Some risk factors are possible in infection of the site, and you might also have a scar in the future. If you don't get this procedure, we can just dress it up and send you home. But like I said, there is a higher risk that you might have an infection post that. Do you agree to get the continuous suture? Okay, perfect. All right then. Well, let me get started with this. I'm going to first wash my hands. Perfect. All right. Now I'm going to put on my sterile glove. No, not my sterile gloves. My regular gloves. I just have one. So I put on my gloves. All right. So now I'm going to cleanse the area. So I'm going to cleanse the area. Now I'm going to prepare some lidocaine. Okay. Now I'm going to inject the insides. Okay. Now I'm going to change my cap for my needle from the one that I originally used because now it's dull. Now I'm going to inject in the edges. I'm not going to recap this. Okay. Now I'm going to irrigate and check for any debris. After I waited 5 minutes for the lidocaine to take action. Okay, it looks like there's no debris in here. Now I'm going to cleanse one more time. All right, now I'm going to put on my sterile gloves with the correct sterile technique. And now I'm going to open up my sterile supplies. And I'm going to drape. How are you doing, Mr. Eugene Stead. Perfect. All right. How's that feeling? It's not too bad? Okay, good. All right, Mr. Gigi, we're almost done. Hang in there for me, okay? right? Seems like you're all ready. Okay, so now I'm just gonna apply some antibiotic ointment. I'm going to dispose the needle in my sharps container and needle in my sharps. Okay, now I'm going to dress this up. And I'm gonna wash my hands once again. All right, Mr. Eugene. Looks like everything should be okay. Please come back in about 10 to 14 days if you do see anything else that like infection coming up or a lot of redness and pus. Come back to us so we can take a look, or go to your primary care physician and they should be able to help you. Do not pick at the wound, and I want to ask if you do you smoke? Okay, perfect if you don't, because it does delay wound healing. For now, I think you're all set to go. Do you have any questions for me? Okay, sounds good. Just remember not to pick at it, and you should be coming back to remove stitches in about 10 to 14 days. Thank you very much, Mr. Eugene. All right, now I'm going to continue with my simple interrupted.